Some medical professionals in operating rooms will already employ their own kind of relaxing affirmations, healing statements. It's natural for them. In other places, this is something that's completely new, but you are entitled through the Patient Bill of Rights at any hospital to be a partner in your own healing and ask for anything, not anything that's going to interrupt the process that the experts know, but you can ask for support.
Hello, and welcome to Not Born Yesterday, a podcast dedicated to older adults and the challenges and joys of aging. I'm Miriam Goodman.
Not Born Yesterday is brought to you by Next Village SF, a local nonprofit providing older adults in the Northeast neighborhood of San Francisco with support to help age in place. I'm Lynn Winter-Gross.
Today on Not Born Yesterday, we're going to talk about the emotional side of surgery. As we age, it's not unusual to need a surgical procedure. Even if your healthcare provider assures you it's no big deal, for the person having the procedure, it is a big deal. Luckily, if there's surgery in your future, it's helpful to know that there are now techniques that will reduce anxiety before surgery, let you use less pain medication afterwards, and help you heal faster.
Julie Bailit is a certified practitioner of a program called Prepare for Surgery, Heal Faster. Based on a book by Peggy Huddleston, Julia's workshops allows individuals to start the healing process by decreasing anxiety and developing more positive attitude before, during, and after surgery. The program takes into account the whole person, body, mind, and spirit. It expedites the healing process by decreasing the use of pain medications and increasing mobility. This translates into a quicker recovery for patients. Julie, welcome to Not Born Yesterday.
Thank you so much.
I understand that you use the book called Prepare for Surgery, Heal Faster yourself, and you found it a life-changing experience. Can you tell me something about that experience and how this program helped you?
Sure. So last November, I was scheduled for surgery. I found out that I had a bizarre tumor called a thymoma on my thymus gland, which was right next to your heart. And the surgeons were worried that they might have to cut out a section of the pericardium, repair it. They were talking about Gore-Tex, and they said, we can either do this surgery an easy way or a harder way. We will start with the easy way, and if we find that the tumor is not intact, we'll do the hard way. And the hard way is cutting your chest open. But we won't know until we're in there. And I was panicked. The unknown, the fear of the scar, the concern about what was this recovery going to be like, it completely derailed me. And I found out about that 2 weeks before surgery. So thankfully, my mother reminded me of this book by Peggy that she had used years prior. And she said, Julie, you need to read this book. This is 2 weeks away. You are so anxious. And I said, okay, I'm finally ready to read this book. I read the book. I followed the guidance. Peggy developed 5 steps for healing. I listened to an MP3 of relaxation twice a day, every day for those 2 weeks. And the morning of my surgery, the anesthesiologist said, how do you feel? And I said, I feel ready. I was absolutely calm. All of that anxiety had gone away. I still didn't know what the outcome was going to be. Part of me believed it was going to be the easy way. That was helpful for my healing anyway. I had no idea, but I was ready. And when I came out of the surgery, I healed so quickly. I mean, I had a meal train set up. I had to ask people to stop bringing me food. 2 weeks after this major invasive surgery, using only Tylenol and Advil, I was feeling great. And I attribute all of that to this program.
The first step in the process is to calm yourself because your immune system is strengthened by the calming and helps the healing. But the prospect of surgery is so scary for everyone that it may be difficult to start that calming all on your own. And if you're a person who's never done meditation before, never done visualization, how do you begin?
I wish I had known that these workshops, these sessions that I offer exist, because having a guide is so important. And I had a little bit of meditation experience. I had used hypnobirthing with my children. So I knew how to calm myself. But the key to the program that I used and that I now teach is using a visualization of yourself healed, healing and healed. People are highly, highly motivated to do this work because fear is so strong. And it feels awkward at first. The first time I listened to the audio, I thought, this is strange. This is foreign to me. I don't know if it's going to work. But I committed to just doing it because I had to do something. And the only assignment was listen twice a day, get comfortable and listen. And anybody can do that. There's no preparation needed. You don't even need to have read the book. That was helpful to me, especially in my training. But if you have a device you can listen to an MP3 on, an audio on, that's it. It's starting as simple as just turning it on.
For years, doctors thought that patients who were under anesthetics could not hear their conversations, but it turns out that they could hear what the doctors are saying, and they often internalize the message, even if it didn't apply to them. For example, in the recovery room, doctors may be talking about a bad outcome for a different patient, but others might hear it and think it applies to them. Has there been a change so that patients can hear only positive messages as they awaken?
Sure. So I learned that when people go under anesthesia, the very last sense to go is hearing. And there have been studies of people who heard pretty awful things during surgery, not just what's going on or what are you doing this weekend, but terrible remarks about the patient themselves. And they wake up and they feel anxious and they feel like, did that really happen? And nurses who've been in the room with them have confirmed, yes, that really happened. And so what this program does, which I think is beautiful, and some surgeons and nurses are already using a method similar to this, is using healing statements. So you as a patient will create a document that you hand to the anesthesiologist. Usually it's going to be a circulating nurse who will read it because you want the anesthesiologist focused on monitoring the anesthesia. You want the surgeon doing what they're expert at. And there's usually someone else in the room who can read these statements. And what the statements do is they provide the audio messaging that you then internalize that becomes a partner in your healing. So the messages are things such as, this surgery is going really well. And the last one is, your healing from this surgery is going to go more quickly and more easily than you could even imagine. And so the patient has handed this document with this list and said, please read these during my surgery at the beginning and as I'm coming out of it at the end. And the request is that they read them 5 times each one. It calms the patient. It's actually been shown to calm the doctors, the nurses in the room. Some medical professionals in operating rooms will already employ their own kind of relaxing affirmations, healing statements. It's natural for them. In other places, this is something that's completely new, but you are entitled through the Patient Bill of Rights at any hospital to be a partner in your own healing and ask for anything, not anything that's going to interrupt the process that the experts know, but you can ask for support. And I've never heard of a case where someone wasn't willing to read these statements and help a patient, because positive outcomes help the patient, they help hospital ratings, They help the physicians. I mean, listening to those positive statements, a surgeon can internalize that calming. It's not meant for them, but you hear a phrase that's calming and beautiful 5 times in the room around you, everybody gets a little piece of that.
One of the things that I wanted to ask you about is you talk about surrounding yourself before surgery with family and friends. And what if you don't have that support group when you're going into surgery, or that support group that's surrounding you with a blanket of love, as I think I read someone use that expression.
Right. So it's the power of community has been proven to heal people. And the community that you have around you can be in that moment. So in simplest terms, you're in pre-op and you have a team around you. In that moment, that's your community. You are surrounded by people who are caring for you and who want you to succeed and have a positive, healthy outcome. So if you didn't have people in your life, family, friends beforehand, it's okay, because you can feel the energy and the positivity and the caring from those people. And some people really resonate with touch. And I have had clients who have said to one of the nurses, "Can you hold my hand while I go under anesthesia? Is that something you would mind doing?" I had someone else hold on to someone's foot. They'll gently stroke their arm. The caregivers, the medical professionals want you to feel comfortable. So that becomes your community in that moment.
So the system that you use includes a book and a relaxation CD and a workshop, but sometimes people don't even have a day or two to get ready for the surgery. So if you have only a day, if you're told, okay, we're operating tomorrow, how do you use your techniques to help that way?
So I have even held a workshop for someone the morning of their surgery, same day. Listening to it once, having me repeat back the visuals that you create, the vivid images in your mind, I bring them to the forefront. Even just listening to it one time before surgery is calming. If it's the day before, let's say we have the workshop in the morning, I encourage people to go about the rest of their day doing all the preparation that they need to do. That evening, listen to the audio one time, and then the next morning, listen to it again. Some people will bring their phone and headphones to pre-op. They'll listen to it while they're waiting. There's some downtime there. And other people have even chosen to have the nurses, once they are in the operating room, put headphones on them and they can listen to it during the procedure.
I want to go back to the question about community and the topic of community and family and friends and getting them involved. We find that with many older adults, they don't want their children to know they're having surgery. So there's anxiety around that and not telling your children. And if you do tell your children, what if they're not believing in the system? Or how do you get them to believe in the system? Do you ever work with the children or talk to the children of older adults who are having surgery to get their buy-in?
Yes. I actually had an experience last week with a mother and her 2 children. And it was very clear that part of her preparation was to hold some of the feelings inside so she wouldn't place any additional burden on her children. And they were asking for it. You can tell us anything you want. We're here for you. But it was her instinct to keep that to herself. And so when we were working together, she was able to release some of that fear and concern and questions and say things like, "I'm just afraid I'm never going to wake up." She wasn't going to say that to her children. Even if everyone was thinking it, she didn't want those words to come out. I have also held workshops where a client and a loved one can listen at the same time. So that way, the person who is the companion is listening to the visuals, is hearing what the the patient needs, their loved one needs. And they too can listen to the audio and visualize their loved one healing. So if you have a parent who has trouble communicating, isn't able to use the audio, you as the caregiver can absolutely use it. And you can visualize the person you're thinking about fully healed on the other side of this.
So is there anything else that you think we should know about your program and how people can use it?
The easiest thing to do is for people to reach out, and we have a 15-minute phone conversation to see if this program makes sense for you. I truly believe that this can help anyone who has any medical anxiety, preparing for surgery, but also people who are suffering from insomnia or migraines. I have a special workshop I do with people who are going through chemotherapy or radiation to reduce the effects of those treatments. It's a slightly different protocol, but it's proven really helpful for people because there's a different need.
That's so heartening. Thank you so much for sharing. That was Julie Bailit of Prepare for Surgery, Heal Faster. Thank you.
Thank you.
Today on News You Can Use, we're going to talk about joints. If it hasn't happened to you, it definitely has happened to someone you know. The doctor tells them they need a knee or a hip joint replacement if they want to continue to have a good quality of life. According to the CDC, there are more than 700,000 knee replacements each year and more than 300,000 hip replacements.
Why are these numbers rising? People are living longer and different parts of our bodies are aging faster. The basic news is that things wear out. Unfortunately, wearing out applies to the artificial knees and joints as well. And doctors now recommend that we try to alleviate pain in these joints with some non-surgical methods first. Of course, if your pain or ability to get around is severe, artificial joints are a godsend and shouldn't be postponed. But if you can postpone your surgery, usually so you won't have to have it again when you're much older, it's recommended try other things first.
For example, lifestyle changes can reduce pain and improve flexibility. Drugs like acetaminophen are helpful as well. If pain is severe, other drugs may be recommended, but one must consider risk versus benefits, so check with your healthcare provider. Non-drug therapies like acupuncture, heat, ice, and massage are also helpful in preserving range of motion and flexibility. But the most important therapy is to stay active. Exercise that keeps the muscles around the joints strong is very important, as it is the muscles that keep those joints supported.
Stretching through yoga and Pilates and even walking can help that range of motion in these joints. Swimming is an ideal exercise as it relieves the weight bearing on the joints while you're in the water. And don't forget resistance training with weights. Again, anything that stretches and supports the joints keeps replacement surgery further away. And finally, as you probably know, losing weight if you are overweight is most important. Anything that lessens the stress on the load-bearing joints will help slow the progress of arthritis that's causing the pain. Weight loss, even as little as 5% of your total weight, can ease discomfort.
You may not be able to postpone joint replacement forever, but controlling the pain and stiffness should be the first approach. Eat a healthy diet, take pain meds as needed, and keep moving. And if it turns out that surgery is your only option, now you know how to prepare for it.
And that's our podcast for today. Our thanks to our guest, Julie Bailit of Prepare for Surgery, Heal Faster. You can learn more about Next Village SF at their website, nextvillagesf.org. Our theme music is from Hook Sounds, and Jason Dahlstedt is our engineer. And thanks for listening. We'd love to hear what you would like us to discuss and discover. Please contact us at notbornyesterdaypodcast.org. Be well, stay strong, and remember, you weren't born yesterday. I'm Lynn Winter Gross.
And I'm Miriam Goodman.